All right, welcome back. We're seeing it more and more. Law enforcement responding to calls involving a person experiencing a mental health crisis.
That's why the Georgia General Assembly passed what's called the co-responder law. Now, the idea, mental health professionals working with law enforcement to help defuse standoffs, domestic disturbances, suicide threats, and other crises. But over the past year, law enforcement told us they've been slow to buy in.
Some of the reasons: the law does not provide funding to pay for those clinicians, and rural Georgia is short of mental health professionals. But a Monday morning standoff presented a teaching opportunity for local officials and health professionals.
Fariha Abra shares how responders successfully responded to the situation.
Need help. Far too often, tragedy follows police standoffs that start off as mental health episodes. The tragic ending doesn't have to happen. In fact, Perry police say they were able to peacefully resolve a standoff at an apartment complex Monday with the help of mental health professionals.
And we did what we were called to do, to provide some support, provide some guidance, some direction, to interview.
It started off as a meeting between Middle Flint Behavioral Health and Perry Police, who were discussing how to set up their crisis response team.
And one of the scenarios that we actually discussed was, how do we handle an individual who's barricaded?
In the middle of that conversation, Chief Alan Everidge says he got the call about a, quote, highly agitated person barricading themselves in a unit at Houston Lake Apartments.
As the conversation with 911 continued, the party made some statements about harming other people, and so our officers were dispatched.
We were able to execute a 1013.
That's the signal for helping those in need of receiving mental health treatment during an emergency. The timely coincidence allowed the mental health team to walk through their response while coaching officers on how to handle the crisis.
Instead of criminalizing a crisis, mental health professionals say that if you treat people, they can get better. Law enforcement says everybody has a responsibility, including those who call and are called for help.
Everidge says the biggest problem is having mental health professionals and deputies available for these types of cases.
So it's about negotiating and responding to the actions of the person that you're dealing with. In this case, he never made an aggressive move towards us.
A trial run that turned into a teaching moment, now serving as an example of what they should do. In Houston County, Fariha Abrar, 13 WMAZ News.
If you or someone you know is experiencing a mental health episode, you can reach out to the Crisis Lifeline at 988, available 24 hours a day, 7 days a week. Now, on the federal level, Georgia U.S. Senator Jon Ossoff says he wants to help. Last year, President Biden signed a bill proposed by Ossoff to help law enforcement respond to mental health situations in their communities. The senator said the bill would provide federal grants for local agencies.